8 warning signs your body is aging faster than it should, most people ignore. What if I told you that two people born on the exact same day, the exact same year, could be aging at completely different speeds inside their bodies? One of them is biologically 65, the other is biologically 82. Same birth certificate, same number of candles on the birthday cake. But their organs, their blood vessels, their brains, their immune systems are decades apart. And here's the part that should make you sit up straight. You have no idea which one you are right now, because biological age doesn't announce itself. It doesn't show up on a standard blood panel. Your doctor isn't testing for it. And the signs it does give you, the ones your body has probably been sending you for months or even years, look so ordinary that almost everyone dismisses them as just getting older. But they're not just getting older, they are your body telling you, clearly and specifically, that something has accelerated, that the wear is outpacing the repair, that the systems keeping you alive and independent are losing ground faster than they should be. I'm going to show you 8 of those signs today. 8 things your body does when it's aging faster than your calendar says it should. Some of them will sound familiar. Some of them will surprise you. And at least 2 of them are going to make you want to call your doctor this week. But here's the good news, and I need you to hear this right now, because I don't want you watching this video in fear. Accelerated aging is not a death sentence. In most cases, it is reversible. The research is extraordinarily clear on this. Once you identify the drivers, once you understand what's pushing your biological clock forward, you can slow it down. In some cases, you can actually turn it back. My name is Dr. Langford. This channel exists for one reason, to help adults over 60 understand what the medical evidence actually says about their health, not what the internet guesses, not what a 15-minute appointment glosses over, what the research shows. Stay with me through all 8 signs because number 4 is the one most people have been living with for years without ever connecting it to aging. And number 8 is the sign that, once you understand it, will change how you think about your health for the rest of your life. Before we start, tell me where you're watching from. Drop your city or country in the comments. I read every single one, and this community has become something I genuinely look forward to hearing from every week. The concept: biological age versus chronological age. Before we get into the 8 signs, I need to give you a concept, because without it, everything I'm about to share will sound like a list of random symptoms instead of the connected pattern it actually is. There are 2 ages living inside you right now. Your chronological age is the number. It's your birthday, it's math. It doesn't change. It doesn't negotiate. And there's nothing you can do about it. Your biological age is the condition. It's how old your cells actually are, how efficiently your organs are functioning, how well your DNA is being maintained, how quickly your body can repair damage. And unlike your chronological age, your biological age is dynamic. It speeds up, it slows down. And the distance between those 2 numbers, that gap, is arguably the single most important metric in all of aging science. Researchers at Duke University followed a group of adults from birth to midlife and discovered that by age 38, some participants had biological ages ranging from under 30 to over 60. Same birth year, same chronological age. Biological ages spanning 3 decades. The question isn't how old you are, the question is how fast are you aging? And the 8 signs I'm about to share are the signals your body sends when the answer to that question is too fast. Let's get into it. Sign number 1. Your grip strength has noticeably declined. I want to start here because this is the sign that the general public pays the least attention to and that aging researchers pay the most attention to. If there is a single physical measurement that predicts how well you will age, how long you will live independently, and how resilient your body is against disease, it is grip strength. That probably sounds strange. Your grip, the thing you use to open jars and shake hands, how could that possibly matter that much? Here's why. Grip strength is not just a measure of your hand muscles. It is a proxy for your entire body's muscle mass, your nervous system's integrity, and your overall functional reserve. When grip strength declines beyond what's expected for your age, it's a systemic signal. It means muscle is being lost throughout the body, not just in the hands. It means the neuromuscular connections that keep you strong, balanced, and physically capable are degrading. A landmark study published in The Lancet tracked over 140,000 adults across 17 countries over 4 years and found that each 11-pound decrease in grip strength was associated with a 16% increase in the risk of death from any cause. Not just frailty, all-cause mortality, heart disease, stroke, cancer, respiratory illness. Grip strength predicted them all. Another study in the British Medical Journal found that low grip strength was a stronger predictor of future disability than low blood pressure, high blood sugar, or even physical inactivity. So here's what I want you to pay attention to. Have you noticed that opening jars has become genuinely difficult? Not just stiff, but something you need help with? Do you struggle to carry grocery bags you used to handle easily? Has your handshake become noticeably weaker? Do you find yourself avoiding tasks that require sustained hand strength? These aren't minor inconveniences. They are early biomarkers of accelerated aging. What to do? Start resistance training. Even simple exercises like squeezing a hand grip strengthener, carrying moderately heavy bags for short walks, or doing farmer's carries with light dumbbells can improve grip strength measurably within weeks. And because grip reflects whole body muscle health, improving it means you're improving systemic resilience. Sign number 2, you're losing height. This one hides in plain sight because it happens so slowly. Half an inch here, a quarter inch there. You go to the doctor and the nurse measures you and you think, well, I must have been standing differently last time. Or the measurement was wrong, or shoes make a difference. Let me tell you the truth about height loss after 60. Some height loss with age is normal. The discs between your vertebrae lose water content gradually. A loss of up to an inch over your lifetime is within the expected range. But if you've lost more than an inch and a half, or if you've lost more than half an inch in a single year, that is not normal aging. That is your skeleton sending a warning. Excessive height loss is one of the earliest and most reliable indicators of vertebral compression fractures. These are small collapses in the bones of your spine that can happen silently, without significant pain, often caused by osteoporosis that has never been diagnosed. A study published in the Journal of Bone and Mineral Research found that women who lost 2 or more inches in height had a significantly elevated risk of hip fracture within the next 5 years, even if they had never broken a bone before, and even if their bone density had not been recently tested. Height loss was the canary in the coal mine, but there's a deeper connection here. A study in the Archives of Internal Medicine found that height loss of more than 2 inches in older men was associated with a 46% increase in the risk of coronary heart disease events. The proposed mechanism is that the same inflammatory processes driving bone loss are simultaneously affecting the cardiovascular system. Your spine and your arteries are aging in parallel. What to do? Know your height. Ask to be measured at every doctor visit and track it. If you've lost more than an inch and a half from your peak adult height, request a vertebral fracture assessment, which is a simple lateral X-ray of your spine that can detect compression fractures your regular physical never would. And start weight-bearing exercise, the single most effective intervention for maintaining bone density and spinal integrity. If you're still with me, take a moment to type the number 2 in the comments. Lets me know you're here and following along. Sign number 3. Your wounds are healing slower than they used to. Think back to the last time you got a cut, a scrape, a minor burn. Maybe you nicked yourself in the kitchen. Maybe you scraped your shin against a piece of furniture. How long did it take to heal? Be honest. When you were 30, a minor cut closed in a few days. The skin sealed, the redness faded, you forgot about it. After 60, if you're noticing that those same minor injuries are taking a week, 2 weeks, sometimes longer to fully close, that is not just thin skin. That is your body revealing a slowdown in one of its most fundamental processes, cellular regeneration. Wound healing is an incredibly complex biological event. It requires adequate blood flow to deliver oxygen and nutrients to the site. It requires your immune system to fight infection and clear debris. It requires stem cells to produce new tissue. And it requires collagen synthesis to rebuild structural integrity. When any of those systems is running below capacity, healing slows. And in aging research, delayed wound healing is considered one of the most visible biomarkers of accelerated biological aging, because it reflects the combined health of your circulatory system, your immune system, and your cellular repair machinery simultaneously. A study in the journal Wound Repair and Regeneration found that chronic slow wound healing in older adults was independently associated with higher levels of systemic inflammation, the kind of persistent, low-grade immune activation that researchers now believe drives nearly every major age-related disease, from heart disease to diabetes to Alzheimer's. Here's the additional concern. If you also have mildly elevated blood sugar, even pre-diabetic levels that haven't triggered a formal diagnosis, wound healing is further impaired because high blood sugar damages the small blood vessels that are essential for delivering repair resources to the injury site. What to do? If minor wounds are taking more than 2 weeks to heal, mention it to your doctor. Request a fasting glucose test and an HbA1c to check for undiagnosed blood sugar issues. Ask about your inflammatory markers, specifically C-reactive protein. And make sure your diet includes adequate protein, zinc, and vitamin C, the raw materials your body needs to execute the repair process. Sign number 4. Your sleep has changed in a specific way. This is the one I told you about at the beginning. The sign most people have been living with for years, sometimes a decade or more, without ever connecting it to accelerated aging. And it's not simply sleeping less, it's something more specific. I'm talking about the disappearance of deep sleep. You go to bed, you fall asleep, you wake up 6 or 7 hours later. On paper, you slept, but you don't feel restored. You feel like you spent the night in a waiting room. Technically present, but not actually resting. Here's what's happening. Sleep is not a single state. It is a cycle of stages, and the most physiologically critical stage is deep, slow-wave sleep. This is the stage where your body releases the majority of its growth hormone, the hormone that drives tissue repair, muscle maintenance, and cellular regeneration. This is the stage where your brain activates its glymphatic system, the waste clearance mechanism that flushes out the toxic proteins, including amyloid beta, that accumulate and contribute to Alzheimer's disease. This is the stage where your immune system performs its deepest maintenance work. When you're 25, you spend roughly 20% of your sleep in deep, slow-wave stages. By the time you're 60, that number has often dropped to 5% or less. And in people who are aging faster than their chronological age would predict, deep sleep can virtually disappear. A groundbreaking study published in the journal Science in 2023 by researchers at Stanford and Harvard found that the loss of deep sleep was not merely a consequence of aging, but appeared to be a driver of it. Reduced deep sleep accelerated brain aging, metabolic dysfunction, and immune decline. It wasn't just that older people slept less deeply because they were aging. They were aging because they were sleeping less deeply. The relationship was bidirectional. Here's what this looks like in everyday life. You sleep 7 hours but wake up exhausted. Your memory feels cloudier in the mornings than it did a few years ago. You feel like you haven't had a truly refreshing night of sleep in months. You nap during the day not because you want to, but because you physically cannot stay alert. What to do? Deep sleep is recoverable. Resistance training, specifically in the afternoon or early evening, has been shown in multiple studies to increase the amount of time spent in deep, slow-wave sleep that same night. Keeping your bedroom cool between 65 and 67 degrees enhances deep sleep duration. Avoiding alcohol within 4 hours of bed is critical because alcohol specifically suppresses deep sleep stages, even when total sleep time appears normal. And if you snore, if your partner has ever told you that you stop breathing during the night, get a sleep study. Sleep apnea demolishes deep sleep architecture and is treatable. Sign number 5. Your balance isn't what it was. Try this right now if you're able. Stand up. Close your eyes. Lift 1 foot off the ground. How long can you hold it? If you're over 60 and you cannot hold that position for at least 10 seconds with your eyes closed, that result is telling you something important about the rate at which your neurological system is aging. Balance is not a muscle skill. It is a neurological skill. It requires real-time communication between your inner ear, your visual system, the proprioceptive sensors in your joints and feet, your cerebellum, and your motor cortex. Every fraction of a second, your brain is processing inputs from all of these systems and making micro adjustments to keep you upright. When that processing slows down, when the signals from your feet to your brain take a few milliseconds longer than they should, when your cerebellum is slightly less precise in its corrections, balance declines. And that decline is one of the most reliable neurological markers of accelerated brain aging. A study published in the British Journal of Sports Medicine in 2022 found that the inability to stand on one leg for 10 seconds in adults over 50 was associated with an 84% higher risk of death from any cause over the next 7 years, after adjusting for age, sex, weight, and existing health conditions. 84% from a balance test. This is not because falling kills you directly, though falls are devastating in older adults. It's because poor balance reflects the degradation of the neurological infrastructure that governs everything else: reaction time, cognitive processing, spatial awareness, motor coordination. What to do? Practice balance daily. Stand on one leg while brushing your teeth. Practice tandem walking, heel to toe in a straight line. If you can do the single leg stand with eyes open, progress to eyes closed. Tai Chi, as I've mentioned in other videos, is one of the most evidence-supported interventions for improving balance in older adults, reducing fall risk by nearly 50% in some studies. Balance is a skill. Skills improve with practice. Your brain can get better at this regardless of your age. Sign number 6. Your gums are receding or bleeding regularly. This is a sign that most people categorize as a dental problem and nothing more. My gums bleed a little when I brush. I should probably floss more. And they leave it at that. Here's what the research says, and it goes far beyond your teeth. Periodontal disease, chronic inflammation of the gum tissue, is not a localized problem. It is a systemic condition. The bacteria that cause gum disease don't stay in your mouth. They enter your bloodstream through the inflamed, bleeding gum tissue. Every time you brush, every time you chew, small amounts of those bacteria are circulating through your body. A 2020 study published in Science Advances identified the primary bacterium responsible for periodontitis, Porphyromonas gingivalis, in the brains of Alzheimer's patients. The bacterium had traveled from the mouth through the bloodstream, across the blood-brain barrier, and into brain tissue where it was producing toxic enzymes that destroyed neurons. The study found a direct, statistically significant correlation between the presence of this bacterium and the severity of Alzheimer's pathology. But the brain connection is only part of the picture. A comprehensive analysis in the Journal of the American Heart Association found that individuals with periodontal disease had a 28% higher risk of cardiovascular events. The chronic inflammation originating in the gums was contributing to arterial inflammation throughout the body, accelerating atherosclerosis, the buildup of plaque in blood vessels. When your gums are chronically inflamed, your body is running a low-grade inflammatory response 24 hours a day. And chronic systemic inflammation is now recognized as one of the primary accelerators of biological aging. Researchers even have a name for it: inflammaging, the slow, persistent immune activation that drives virtually every age-related disease simultaneously. What to do? Take gum health seriously. If your gums bleed when you brush or floss, that is not normal. See a dentist. Get a periodontal evaluation. Brush twice daily with a soft electric toothbrush. Floss daily. Consider an antiseptic mouthwash. And if you've been skipping dental visits because nothing hurts, understand that periodontal disease is painless until it's advanced. Your mouth is a window into your body's inflammatory status. Keep that window clean. If you're finding this valuable, take a second and hit the like button. It helps this information reach more people who need to hear it. Sign number 7, you've noticed changes in your voice. This is the sign almost nobody talks about, and it's one of the most fascinating findings in recent aging research. Your voice is changing. It's gotten thinner. It's lost some of its volume. Maybe it cracks occasionally or gets hoarse by the end of the day. You assume it's just age? Your throat is drier. Your vocal cords are wearing out. Here's what's actually happening. Your voice is produced by the vibration of your vocal cords, which are muscles and connective tissue in your larynx. Like every other muscle and connective tissue in your body, they are subject to age-related atrophy. They lose mass, they lose elasticity. The collagen fibers that give them their flexibility begin to stiffen. But here's the part the research finds remarkable. The rate at which your voice changes appears to be correlated with the rate at which the rest of your body is aging. A 2021 study in the Journal of Gerontology examined vocal biomarkers in adults over 60 and found that measurable changes in voice quality, specifically reduced volume, increased breathiness, and vocal instability, were significantly associated with decreased physical function, lower grip strength, and higher frailty scores. Your voice isn't just changing because of your throat. It's changing because the muscles throughout your body are losing mass. The respiratory muscles that support voice projection are weakening. The neuromuscular control that keeps your voice steady is becoming less precise. Your voice is a mirror of your systemic musculoskeletal health. A separate study at the University of Tokyo used voice analysis software to predict biological age and found that voice recordings alone could estimate biological age with remarkable accuracy, often identifying accelerated aging before standard medical tests did. What to do? Use your voice. Singing, reading aloud, even humming engages the vocal muscles and the respiratory muscles that support them. Resistance training improves the core and respiratory muscle strength that projects your voice. Stay hydrated because vocal cord tissue is extremely sensitive to dehydration. And if your voice has changed significantly over the past year, particularly if you're also experiencing swallowing difficulties, see your doctor. It could indicate something treatable. Sign number 8. You've lost your sense of smell. This is the sign I told you at the beginning would change how you think about your health. And I saved it for last because the science behind it is both the most alarming and the most actionable on this entire list. Start with a question. Think of your favorite food. Can you smell it in your memory? Now think about the last time you actually smelled something and it triggered a strong, vivid response. Was it recent? Or has that intensity faded? Do you find yourself adding more seasoning to food because it doesn't taste the way it used to? Has your partner ever mentioned a strong smell in the room that you couldn't detect? Here's what the research says. Your sense of smell is processed by the olfactory bulb, a structure that sits directly beneath the frontal lobe of your brain. It is one of the few brain regions that maintains the ability to generate new neurons throughout life. And because of its location and its continuous regenerative activity, it is often the first area of the brain to show signs of neurodegenerative decline. A study published in the Annals of Neurology followed over 2,200 adults with normal cognitive function and found that those who scored lowest on a standardized smell identification test were more than 5 times more likely to develop Alzheimer's disease within the next 5 years. 5 times. And this finding held even after adjusting for age, sex, education, and genetic risk factors. The loss of smell preceded memory loss. It preceded confusion. It preceded every clinical symptom of Alzheimer's. In many cases, smell decline was the first detectable sign that the brain was changing, years before anything else appeared, but the connection goes beyond Alzheimer's. A 2014 study in PLOS1 followed over 3,000 adults aged 57 to 85 over a 5-year period, and found that those with the poorest sense of smell had a mortality rate nearly 4 times higher than those with normal olfaction. Loss of smell was a stronger predictor of 5-year mortality than heart failure, cancer, or lung disease. Why? Because your olfactory system is uniquely connected to the parts of your brain that regulate autonomic function, immune response, and cellular repair. When it declines, it reflects a broad deterioration of the neural networks that keep your entire body functioning. Here's the good news. Smell loss can be slowed and in some cases partially reversed. A technique called olfactory training, systematically sniffing 4 distinct essential oils, rose, eucalyptus, lemon, and clove, for 20 seconds each twice a day, has been shown in multiple clinical trials to improve olfactory function in older adults. A study in the journal Chemical Senses found measurable improvement in smell identification scores after just 12 weeks of consistent training. This works because the olfactory system retains its neuroplasticity. You are literally stimulating new neural growth in one of the most vulnerable and important areas of your brain. 20 seconds per cent, twice a day, 4 cents. That's under 3 minutes of daily investment in the part of your brain most likely to signal early decline. What to do? Take a smell test. The University of Pennsylvania Smell Identification Test is a validated, commercially available tool. If your score is below the expected range for your age, discuss it with your doctor. Begin olfactory training today. And pay attention. If foods have become blander, if your morning coffee doesn't have the aroma it once did, if flowers seem less fragrant, don't dismiss it. Your nose might be trying to tell you something your brain won't show for another 5 years. Your action plan, the biological age. Check. Here's what I want you to do this week. 5 steps, 10 minutes of your time, and a potentially life-changing conversation with your doctor. Step 1. Test your grip. Get an inexpensive hand dynamometer online. Test both hands. Compare your result to the age-adjusted norms that come with the device. If you're below the 25th percentile, that's information worth acting on. Step 2. Measure your height. Compare it to your height at age 30 or 40. If the records exist in your medical chart, ask for them. A loss of more than 1.5 inches deserves investigation. Step 3. Try the balance test. One leg, eyes closed. Time it. If you can't reach 10 seconds, you know where to focus. Step 4. Take a smell test. Buy one online or ask your doctor about olfactory screening at your next visit. Step 5. Schedule what I call a biological age conversation with your doctor. Bring your results. Tell them you want to understand not just your health status, but your aging trajectory. Ask about inflammatory markers like C-reactive protein. Ask about fasting insulin, not just glucose. Ask about your vitamin D level, your B12, and your thyroid function. These are the markers that reveal how fast the engine is wearing, not just whether it's still running. Any physician worth seeing will welcome this conversation, and if they don't, you deserve one who will. I want to leave you with this thought. Your body is talking to you. It has been talking to you for years, not in dramatic emergencies or sudden crises, in whispers, in small changes, in things you've been dismissing as just getting older. The 8 signs I shared with you today are not death sentences. They are conversations. Your body is asking you to pay attention, to adjust, to respond. And the extraordinary thing about biological aging is that it bends. It responds to what you do. The research is unambiguous on this. Exercise, sleep, nutrition, stress management, social connection. These are not just nice ideas. They are biological interventions that measurably slow and in some cases reverse the aging process at the cellular level. You are not a passenger in this. You are the pilot. If this video opened your eyes to something you hadn't considered before, I need you to do 2 things for me right now. First, subscribe to this channel and turn on notifications. I release a new video every week, each one built on the same foundation: real research, plain language, practical action. If you found value in this video, the next one is going to take it even further. Next week, I'm covering the 6 blood test results your doctor calls normal that aging researchers say are anything but. Numbers that are technically in range but that predict disease years before it arrives. You'll want to catch that one. Second, share this video with one person. Just one. A spouse, a sibling, a friend, a parent. Someone over 60 whose health you care about. Because the person who most needs to hear this probably isn't going to search for it on their own. You might be the reason they find it. You might be the reason they test their grip or check their height or start smelling those 4 oils every morning. You might be the reason they catch something early enough to change it. That's not a small thing. That's everything. Take care of yourselves. I'm Dr. Langford. I'll see you in the next one.